Hello and welcome to the Fertility Foundations podcast, where we go into detail about how to prepare the foundations for a healthy pregnancy. We dive deep into the underlying causes for fertility issues and natural solutions, empowering you to take charge of your own path to parenthood. I'm Sandra Greenbank, nutritional therapist, functional medicine practitioner, coach and educator, specializing in fertility, pregnancy and postpartum health. Today I'm speaking to Dr. Victoria Sampson about the connection between oral health and fertility. This is a subject that's really a special interest of mine, and I'm really excited to talk to Dr. Victoria. Victoria obtained her bachelor in dental surgery from Barts in London. She's now known for her work in developing saliva diagnostics, microbiome testing, and incorporating artificial intelligence into everyday care. Her work has been acknowledged worldwide, resulting in her becoming a scientific advisor, board member, and clinical lead of multiple dental companies globally. She also has a postgraduate diploma in periodontology. Victoria has published numerous papers internationally, with her most recent publication in the British Dental Journal being the most cited and viewed article ever published. Most recently, Victoria was shortlisted as one of the most promising young scientists in Europe for the Forbes 30 Under 30 in Science and Healthcare 2022 for her efforts and devotion to healthcare. She's the first dentist to ever shortlist for Forbes. She's also won several national prizes for her research, and she's one of the co-founders of the Health Society in Mayfair, London, the first multidisciplinary health centre where she practices functional and precision dentistry aimed at connecting the oral microbiome with general health. She's also a topical team member of the European Space Agency and NASA, aimed at creating guidelines for astronauts before long-haul flights. So today we're talking about the connection between the oral cavity and fertility and pregnancy health. And I can't wait to hear what Victoria has to say. Victoria, thank you so much for joining me on my podcast. I'm so excited to talk to you. I've got a huge personal interest actually in the oral cavity and the oral health and how it relates to actually brain health and diabetes personally, but that's not what we're here to talk about today. But it's so nice to get to finally catch up with you.
Thank you so much for inviting me, and I'm looking forward to talking all things oral microbiome with you.
Yeah. So first of all, when we talk about oral health, what is it we're talking about, apart from the absence of cavities, which we're all trying to avoid?
So I think that most people kind of just think that their oral health just means, like you said, absence of cavities and I guess no gum disease. But no one, firstly, really, I think, fully appreciates what gum disease is, and that it can appear in multiple different ways, and it's a whole spectrum. So it's not that your teeth are falling out. There's a lot more that happens before that, which is still very detrimental. I think the first thing to kind of start with is kind of what the oral microbiome is. So your mouth is actually just it's a microbiome. And so what a microbiome means is that it's an ecosystem of millions of bacteria. So about 700 different species of bacteria, which make 2 billion bacteria in the whole of the mouth. And it's similar to your gut in the sense that your gut has a microbiome, and probably all of you who are listening have taken a probiotic or a prebiotic or something for your gut because you've had some issues. It's very similar to your mouth. And unfortunately, people don't pay as much attention to their oral microbiome as they do their gut microbiome, often because the symptoms of an imbalanced oral microbiome are pretty silent until it's pretty late on, and we're at quite a severe stage. So you've got all these bacteria, you've got your good and your bad bacteria, and you want this whole ecosystem of them, and they need to be in a balance. So it's not that you only want fantastically amazing bacteria in your microbiome. You actually always will have a little bit of bad bacteria in there, and it's about just keeping those at low levels and in check. And when you have high levels of those bad bacteria, then that's when we start to see certain diseases. So when we stick with just the mouth, we've got the oral diseases like decay. So those are cavities and when you need fillings. And then also things like gum disease, which, like I said, is a spectrum. So you've got from early stages of just maybe your gums bleeding a little bit to then maybe your gums hurting. And then we have something called pocketing. So that's when the gums start to have a distance between them and the tooth. And so you can actually essentially put something down the gum and leave it there, and that's a pocket. And then those pockets can get worse and worse and worse, and that leads to bone loss. And then at the very, very far end of the spectrum is when you start getting, really bad breath. You're getting infections around your gums, and ultimately tooth loss is the last one. That's your oral. And then general, which I think is the reason I'm here, is that the oral microbiome, and when it's imbalanced, has a lot of connections with other general diseases. And so it's not a separate entity to the rest of your body. And, having a healthy mouth is not just about reducing your risk of decay, but also reducing your risk of other diseases and problems with the rest of your body.
Okay. And so how does it link then to the rest of the body in terms of the bacteria that's there can travel?
Yeah. So you've got a few different mechanisms. The first is, like you said, literally bacteria in your mouth traveling. So that can either be through swallowing and it goes straight to your gut, or it can be through your blood. So there's tiny little blood vessels in your mouth, and the bacteria can actually travel through those blood vessels and travel elsewhere, and that can cause infection elsewhere. So imagine if you are having an infection somewhere else in your body, and this bacteria from your mouth is traveling and also just kind of like adding petrol to the fire. So it's just adding more bacteria in there that's just not needed. And so a lot of infections that we see, so for example, COVID, which I did a lot of research on, patients who were suffering from COVID had a lot of oral bacteria in their chest and in their lung cavity. And they were actually often dying of bacterial infections, which were associated with oral bacteria. So that's the first mechanism. The second is that you've got this bacteria, it's causing all these problems in your mouth. And the way that the mouth responds, or generally the body responds to kind of insult or harm, is it releases inflammation. So this is a low-grade chronic inflammation. And this is essentially where you're firing out lots and lots of inflammatory markers, but at kind of a low level. So it's not enough where maybe you're like, oh my God, my mouth is in pain, or I'm having so many problems. But these inflammatory markers are able to travel again elsewhere throughout the body. And for example, if you have another inflammatory condition like arthritis, or even something like Alzheimer's, or anything which it has a lot of inflammation, then those inflammatory markers that are being released in the mouth will travel and again add petrol to the fire and just make that inflammation 10 times worse. So those are the two main ones. Oh, and the third one, last one is that it can actually it can harm your blood vessels. So a lot of the inflammatory markers, and there are some enzymes which are released by bacteria in the mouth. And again, they travel throughout the body, and they can actually destroy blood vessels. They can make blood vessels get a lot thinner or a lot smaller, so that they cannot kind of dilate and enlarge with blood flow or anything like that. And that's where we see the connection with things like heart disease, even things like erectile dysfunction. It's again because blood cannot travel because the blood vessels are being damaged.
Okay, so that really makes sense with the link to heart disease, because that's very well established, and I think most people sort of might have heard about this. But then the link with brain health and pregnancy health, I suppose, is more, you're thinking then about the barriers and the blood-brain barrier, and do these bacteria cross the placenta?
Yeah.
And the inflammation?
Yeah, exactly. So all of those mechanisms that I just mentioned are all related to pregnancy and to infertility as well. And so with the placenta, yes, you're right. So there are certain bacteria, one in particular, which is called Fusobacterium nucleatum. And that bacteria can very easily cross the placenta and travel in and increase the risk of fetal toxicity, and just kind of introducing bacteria into a place which no bacteria is meant to be. And that can cause a lot of problems like low preterm birth, or early birth as well, so premature birth, and then also fetal toxicity as well.
And is this why you get free dental treatment on the NHS when you're pregnant? Or is it to do with just generally your teeth kind of get more vulnerable at that time?
Combination of both. Yes. So a lot of it is to do with just preventing those diseases, because I think the reason I'm so passionate about this kind of side of dentistry is that it's so easy to prevent and so easy to sort out, unlike a lot of other problems in our body, which can take, months or years or loads of money to sort out. If you have a little bit of gum disease, just getting your hygienes done regularly and properly could be enough to actually reduce your risk of other problems, or using the right toothbrush and toothpaste. It could be a £10 change in your life, but it could actually really have a huge consequence. So you're right. Yes. So NHS does provide free treatment for pregnant patients. And part of it's to do with preventing problems like infections whilst a mother is pregnant, because the last thing you want to be doing is prescribing antibiotics whilst a mother is pregnant, and for her to be having abscesses and infections and pain and problems. And then the other thing is that actually you're right, when you're pregnant, you are a lot more vulnerable to dental diseases. So the hormones during pregnancy impact the gums quite significantly. And so a lot of women will get something called pregnancy gingivitis. And if they don't sort that out and kind of have their hygienes regularly and etc., then that can become proper gum disease later on. And so it is very important, to keep your hygiene and your dental health very good whilst you're pregnant.
So that all makes sense, but also kind of when you're pregnant, the horse is bolted, because there's so many things then that first of all, the preventative should start way before, shouldn't it? And also, I'm sure you're also limited, as we are, with some things that we would like to do during, but we would like to do it before pregnancy, because you then become so limited as to what you can actually put in, or the things that you can use therapeutically, as opposed to actually fix the problems. Is there like sort of like a checklist of things that you should do, and how long before you try to conceive ideally should you be doing these things?
So I would say, during actual pregnancy, like you said, you don't want to be having problems at that point. You want to be completely fine, so that you do have to kind of sort that out before being pregnant. But during pregnancy, for all of my pregnant patients, I recommend they come in for a hygiene every 3 months. I don't care if they don't think they need it, or they say, oh, it's too often or something like that. Your gums are absolutely crazy during pregnancy. And they're also usually very sore. They bleed a lot, and the saliva in your mouth also changes during pregnancy. So it's really important that the gum health is kind of maintained. So every 3 months is your hygiene. Then pre-pregnancy, again, there's been a lot of connections with fertility and gum disease. So just making sure that your hygiene is good, that you are going and seeing a hygienist regularly, and you're, taking care of your mouth at home as well. And then if you are trying to conceive, I would also ensure that there's no dental diseases. So having like full checkups and just making sure that there's no signs of infection.
That sounds like really good advice. I think that we tend to work a lot on inflammation as well, and reducing inflammation, because that generally inflammation in the pelvic cavity actually does impact your egg development, your egg health. And so it does make sense to kind of do that 360, just sort of that service, I suppose, before you go and try for a baby. But what about the male partner? Is there any research or any sort of knowledge that we have that we can pass on to the male partner, who might be a little bit less easy to convince?
Yeah. So, sorry, going back a second, I forgot to say a study for women is that there was a study that they did where they basically improved the dental health of women who were trying to conceive. And what they found was that by having gum disease, that slowed down the conception by 3 months. So if you had gum disease, you were less likely to conceive, or it would take you 3 months longer to conceive than someone who doesn't have gum disease. And then also that there's the certain inflammatory markers that are released in gum disease actually prevent the release of some of the hormones that are connected to conception. So your gonadotrophin and your luteinizing releasing hormone as well. So it reduces the levels of those, which then means that obviously your chances of conception are reduced as well. From the male side of things, it's actually, I would say, I mean, it's really important. And like you said, men are sometimes a little less enthusiastic to go for it. So the first one is with just infertility. So, and I'm working at the moment with a male infertility clinic. And basically the reason why is that there's a big study where basically they had a couple of hundred men, and they did a full dental checkup on all of these men, and they found that all of these men, by the way, are subfertile. And so they did a full checkup, and 95% of them had some sort of dental disease, be it an infected tooth or gum disease, or something needed to be done, basically. And then they split the group in half, and half of the group had all of that dental treatment done and all of their infections resolved, and the other half were left to their own devices. And what they found was that those who had the treatment were significantly more likely to conceive within 6 months. So much so that it was, I think, 90% success rate of conception within 6 months of having that dental treatment sorted out. And the other group who had no dental treatment, there was no change. I think it was like a 5% success rate. So it was like such a huge difference and change between them. And then in terms of erectile dysfunction, there was also a big study which showed that patients or men who have gum disease were 2.85 times more likely to suffer from erectile dysfunction. And the reason for that is, if you rewind back to the beginning of this podcast where I was just talking about the mechanisms, and the last mechanism, which was about your blood vessels, oral bacteria can alter those blood vessels, and when they constrict, so when they tighten or when they dilate and they become larger. And so what happens is that less blood is able to travel to the penis. And so you have erectile dysfunction as a result of it. So that usually gets the men coming in for their dental treatment when I say that, but I think you're very right to also put a lot of focus on men when it comes to conception. And that's why I'm working a lot with male infertility clinics, because it takes two to tango, and a lot of the time the men are kind of like, oh, okay, well, it's not my problem, when actually often it is their problem. It's partly their problem too.
That's really interesting, because I've read a couple of studies that link male factor infertility with heart disease later in life. So there's a correlation, and that makes complete sense now, that could be part of the links with because we know that heart disease is something that you set the stage sort of 10, 20, 30 years ahead of the event. Yeah. And then that can be that smoldering fire that's kind of just going on in the background for all of those years. But the other reason why I ask is because men just won't go to the doctor. They certainly won't go to the dentist unless they are in severe pain. Let's face it. But also the microbiome is shared, right? Yeah. So if you know that your partner's oral health is potentially not as great as it could be, how is it potentially impacting you personally?
Yeah, so you're completely right. The oral microbiome is very much shared between partners. There's been a lot of research to see whether or not it's because of literally exchange of saliva and essentially from kissing, or if it's to do with actually the fact that two partners will often live together at this point. They're sharing the same foods, habits, environment, and so it's sometimes difficult to differentiate between the two. But there was a study which shows that if you kiss your partner more than 12 times a day. And that's even a small, it's not like a big, long, sloppy smooch. It's even just a peck. More than 11 or 12 times a day, then you will probably have exactly the same oral microbiome as your partner. So there is a huge transfer of bacteria. And you're right, if one is taking very good care of their microbiome and brushing and taking care of themselves, and the other one is not, then it kind of balances out to just being like quite average in a way. And so again, both people need to be really working hard to make sure that they have good dental health.
Yeah, that does make sense. And so you mentioned some of the signs and symptoms, like gums bleeding when you brush them, or when you brush your teeth, pockets or visible. What about plaque? What is plaque?
So plaque is basically it is partly your microbiome. So plaque is essentially a combination of carbohydrates from your saliva, and things that we've eaten, which are then they create like a nice bed or mattress for some bacteria, and those bacteria then are able to grow on that kind of carbohydrate mattress, if you want to call it that, and that creates plaque. So it's like a kind of thick or thin film. It's also called biofilm by some people call it that, and it can just cover the teeth. And if it's left there, we get biofilm and plaque growing immediately. So after a clean, for example, it takes an hour or two for the biofilm to grow back again. And so every time you're not brushing your teeth, you're probably having some sort of plaque. And this might sound gross, but I'm sure all of you have listened. And there's been 1 or 2 days where you may have forgotten your toothbrush, or you've not brushed well enough. And sometimes if you put your finger or you try and wipe it, you might get a little bit of that white stuff on your finger. And that is plaque. And that's a thick amount of plaque, but you always have some on your teeth. And if it's left there for too long, so I'm talking, a day to 2 days, then you start to get a little bit of inflammation because the gums aren't able to breathe. And the plaque is essentially kind of suffocating those gums. And then as the time goes by and you're still not disrupting that biofilm or the plaque, then it becomes thicker and thicker and thicker, and more bacteria allowed to grow. And then the kind of composition of bacteria changes because all of a sudden you now have a very thick amount of bacteria. And so some of them aren't able to live with oxygen, some of them can. And that's when we start to see more dental diseases or general diseases starting to grow. And what's interesting about the mouth is that it's the only part of the body which is, or the teeth are the only part of the body which is non-shedding. And so what that means is that every part of your body, your skin, your hair, your everywhere, it sheds. So we're always losing skin cells or hair follicles or all of that stuff, but the teeth do not shed. So if someone is not going and manually removing that plaque and biofilm and that bacteria, then it can stay there for years, and that's where we start to see problems. And that's why it is so important to brush your teeth. It's not just for fresh breath; it's to essentially remove that plaque and biofilm so that everything can breathe and you don't get those diseases.
Okay, and that eventually leads to periodontal disease where your gums loosen, and then I suppose eventually your teeth will fall out if you not.
Yeah. So those gums loosen, and then that plaque can basically travel down into those pockets, and then they become far more kind of pathogenic or dangerous bacteria because, and that's when they start to really cause destruction.
And all of this time, it's also affecting your heart, your brain.
Yeah.
Every cell in your body basically because it's going into the bloodstream. Yeah. Okay, lovely. So you mentioned testing. So I know obviously you work closely with in vivo labs, and I love them as well for all of their microbiome testing. And that's could you talk us through a little bit about oral microbiome testing, and not necessarily just through in vivo, but what is the kind of clinical significance or usefulness of this, and who should be thinking about this?
Yeah, so the oral microbiome test is, the one from in vivo is that we collect essentially your saliva and we send it off to the lab, and then that saliva is kind of investigated, and we look at all of the bacteria in your saliva, And that bacteria is essentially what your oral microbiome is made out of. So we look at the top 20-ish bacteria in the oral microbiome, which are associated with gum disease, decay, but also they can start to give you insights into other parts of the body. So things like a gut dysbiosis, so an imbalanced gut, or even that chronic inflammation. And then we also look at fungi as well. So if you have any thrush or candidal infections too. And the benefit of doing an oral microbiome test is that it gives you a snapshot into what's going on in your mouth. If, for example, you are trying to conceive, and you know that you have really high levels of some of the worst bacteria associated with gum disease, and you have really high levels of Fusobacterium nucleatum, which I was just saying is the one associated with fetal toxicity and with preterm birth, then you might be more compelled to sort out your oral microbiome. From my side, by having all of that knowledge, it allows me to create a more personalized and focused treatment plan. So in my opinion, it's not enough just to tell someone to brush better or to use a toothpaste. It's about what toothpaste, what mouthwash, what foods, supplements, everything that we can do to try and get rid of those bad bacteria and then to replace them with better and good bacteria. So I do a lot of oral microbiome testing in my clinic. And we create personalized prevention plans for these patients. And it's a combination of things that they do at home, mixed with things that we do in the practice, using certain gels and all of those types of things, which are focused at each bacteria, which are elevated to then get rid of them. So I'd say that's like your main reason for doing oral microbiome testing. I got a lot of people who are just interested and they just want to optimize their health, and that's completely fine too. If you have gum disease, I would say, and now I make every patient who has gum disease do an oral microbiome test, because in what I found is that by doing that test and creating that personalized treatment plan, their response to treatment is significantly better than if we were to kind of do like a blanket generalized treatment for everyone who has gum disease, because we're all different.
Okay. I mean, I think that we're all convinced about how important it is to look after oral health. So aside from seeing your dentist regularly, and how often should you see your dentist?
So that should be kind of dependent on your risk of dental diseases. So generally, I would say the bog standard is every 6 months for a checkup. Some people, it might be every 3 months if they have a lot of problems or lots of stuff going on in their mouth. And for someone who's absolutely phenomenal and, you know, really, really amazing hygiene and no fillings, maybe every 12 months. But if you're not sure, 6 months.
And the hygienist? I mean, my dentist has never ever sent me to the hygienist. I've never been to the hygienist, and I don't have any fillings either. But I sort of think, you know, should I go? I mean, you know, again, how often should you see someone? I know you said every 3 months during pregnancy, but aside from that.
So again, it depends on your risk and every person's mouth is different, but I would say the average is every 6 months. At my clinic, we do probably every 4 months, is what we recommend. So every 3 to 4 months. And the reason for that is because we do a special type of hygiene, which is called guided biofilm therapy. And what that means is that we basically disrupt the biofilm and the bacteria and the plaque that I was talking about. And the more regularly you do that, then the better the microbiome is. And the less painful your hygiene is, because you're not allowing for all of that buildup. You know, the worst thing and the reason why people find hygiene so uncomfortable is that they don't do it often enough. And then when they, you know, let's say they don't come for 2 years and they come and they have so much buildup and their gums are really inflamed. So when we try and go in there, everything's painful and they hate it. So if you go more regularly, it's less painful. And you're less likely to have dental diseases. There are a lot of people who, like you, who don't see a hygienist necessarily. Their dentist might do a clean. And, you know, everyone's different. I'm a dentist, but I do quite a lot of hygienes as well. What I would say is it doesn't matter who does it necessarily, but more that you are having a devoted appointment to your hygiene. What I don't agree with is, having a checkup and someone just afterwards doing a quick 5-minute clean and just being like, yeah, okay, cool, you're all good. That's not enough. Everyone's got bacteria. Everyone's got stuff that needs to be cleaned. And I think everyone needs to have a devoted appointment for their hygiene, a good 30 to 40 minutes, at least every 6 months to keep that in check. And I always compare it to any ladies out there. If you, for example, don't wax, and all of a sudden, once every 2 years, you do a bikini wax, it is the most painful thing in the world because you've let everything, grow, and it's really, really painful. And it's the same with the hygiene. If you let everything just build up, you're going to hate us. So you need to come regularly, and it will be a lot more enjoyable for you too.
Okay, so don't necessarily listen to your dentist when they say you don't need one.
Yeah, I don't.
Book yourself in anyway.
Yeah, I just think everyone needs one, and it's not always about removing like visible calculus. It's about disrupting the biofilm. It's about getting under those gums, because you're never getting under those gums when you brush your teeth. But you shouldn't be. That's something that only your dentist or hygienist should be doing. But everyone needs a little bit of it once in a while, just to keep everything in check.
Okay. And so I'm going to ask you a few questions in a minute about, products and some of the things that we can use. But just before I do that, what should we not do?
So smoking is one of the worst things for the gums, because it reduces your blood flow, it reduces your chances of healing, but also because it's reducing your blood flow. What we were saying earlier about one of the biggest or the first symptoms of gum disease is bleeding gums. If you're a heavy smoker, you won't get bleeding gums. You will have gum disease, but it's actually kind of camouflaged by the smoking. And so people are like, oh, my gums don't bleed, they're completely fine. And then they have horrendous gum disease because they've actually missed that first symptom. So smoking, I literally actually just read a paper this morning, and I just wrote a post about it, about general lifestyle. So now there's a lot of research which is showing that a good diet, so Mediterranean diet, has been shown to be the most beneficial. Good physical activity, reduced stress, everything that we all know. And also good sleep quality are strongly correlated to better results from gum treatment and reducing your chances of gum disease. In terms of diet with sugar, it's more about the number of times that you have sugar a day as opposed to how much sugar you're having. So I have a massive sweet tooth. I love sugar. I'm probably the worst dentist, but what I do is I just basically eat all my sugar in one go. So like after lunch, for example, I like to have some dessert, but I only have it once, and I eat it. I could eat, a whole cake if I wanted to, or 15 chocolate bars. But if I do it all in one go, it's much, much better for my mouth than if I was to eat a chocolate bar every hour. And you can go smaller to, for example, M&Ms. If you were to have an M&M every hour, then it's worse than just having a huge bag of M&Ms in one go. And that's because your saliva is constantly under attack. And that's where we start to see patients who have lots and lots of decay, because their saliva is never able to get back to a healthy place to then remineralize and strengthen the teeth. Hydration, so dry mouth, is also a really, really big problem for dentists, because your saliva is your best friend, and your saliva's got lots of good proteins and enzymes and all of the food for all of that bacteria in your mouth. And it also reduces the risk of decay. So if you have a dry mouth, and that could be medically induced from medication that you're taking, or it could just be some people have a bit of a dry mouth, then making sure you're keeping it hydrated. And also maybe stimulating your saliva flow. So that could be through chewing on something, sugar-free gum, or chewing on like a pastil. So I like these probiotic pastils. I chew them quite a lot. And that's just to kind of lubricate the mouth regularly and make sure that it's all in check.
Okay, probiotic pastils. I've never heard of those, actually.
Yeah, they're really good. They're just it's like a mint, but it's got some probiotics in it. And you just chew it, and it tastes quite nice, and it's sugar-free. And I love Biotics, which there's quite a few, but that's the one that I like the most.
Okay, that's really interesting.
And also it's really interesting what you say about all of the things that you just mentioned, the Mediterranean diet, sleeping, except, it's all the same. It's all good for your fertility anyway. So, okay. So I've got some sort of quick fire questions that, they've sort of been playing on my mind for ages. And I would love for you to kind of just say, yes, this is a good thing, or no, you should avoid it, or use this instead. So first of all, fluoride.
Yeah, this is always the one that everyone
$1 million question.
Yeah. And you'll hear lots of different responses depending on who you ask. For me personally, I'm kind of in the middle. So I believe in having a little bit of fluoride in your toothpaste, but not having too much fluoride. So the reason for that, well, I guess firstly, the reason people don't like fluoride and they're scared of it is because there has been some research to show that having high levels of fluoride and ingesting it can have neurotoxic effects, and it can also have impact on your bone and those types of problems. The problem I have with that argument and with that research is that we're not ingesting our toothpaste, and the research that has been done on it is talking about eating very high levels of fluoride, like having 2,000 tubes of toothpaste in a day kind of situation. So anything in such extreme levels is going to be dangerous and bad for you. So that's why I'm not anti-fluoride completely. And the pro-fluoride argument is that fluoride is very, very protective for the enamel. It reduces your risk of decay significantly. And so patients who are putting fluoride in their toothpaste have a much lower risk of decay and having problems. So I'm in the middle. So I like to have a little bit of fluoride because I've also seen so many patients who switch to fluoride-free toothpaste, and all of a sudden within a year, they need 10 to 15 fillings. And it's so horrible to see. So yeah, I would go for I still like fluoride, and I still recommend it to a lot of my patients. It's about how much, and also obviously if you have children, making sure that you're going within the guidelines for children and their age groups as well.
Yeah, because children probably do swallow a fair amount of toothpaste, as they're sort of just also, especially if it tastes nice. Some of them sort of have like bubblegum flavor and all, What about hydroxyapatite? Is that how you say it?
So hydroxyapatite is great. So it's basically what your teeth are made out of. And so what the hydroxyapatite does in toothpaste is, well, the aim is to try and replace that maybe lost hydroxyapatite through decay and through problems with the stuff in the toothpaste. It's very good. It's still a bit up and coming in the sense that there aren't lots and lots of hydroxyapatite toothpaste on the market. And so another problem is that the particle size of the hydroxyapatite is very important. So if you're trying to replace your hydroxyapatite in your enamel or in your tooth, it needs to be the right particle size. And unfortunately, there's lots and lots of hydroxyapatite toothpaste on the market where the particle size is either way too big, where it's not going to do anything, or it's way too small and it's actually causing harm sometimes. So I'm yet to find a hydroxyapatite toothpaste that I am really, really, loving and, happy with. And I'm still a little bit on the fence of replacing fluoride toothpaste with a fully hydroxyapatite toothpaste. So the one I recommend mainly is something that has a little bit of both. So it's called Biomin. I'm not sponsored by them, by the way. So, but it's got calcium and phosphate, which is also what hydroxyapatite is made of a lot. And also it's got fluoride. But your normal fluoride toothpaste, if you were to go and buy something off the shelf, is usually around 2,000 to 2,500 parts per millimeter of fluoride. And this has about 500 or no, maybe 700 parts per millimeter of toothpaste, of fluoride. And so it's a much lower level of fluoride. But the way that it's delivered means that it's got the same effect as a high fluoride toothpaste. So that's why I like it. It's in the middle. It's got a little bit of fluoride, but not too much. So people can't be too scared of ingesting it or any problems. It's got your calcium and your phosphate from the hydroxyapatite perspective. And it's also not too expensive. That's another problem with hydroxyapatite, is that some of these
very
toothpaste,
expensive.
they're like, I can't ask my patients to spend £25 on toothpaste, and get it shipped from the US, and it's it's not easy. So I think for most people that's a good middle ground.
So what was it called again?
Biomin, Biomin. So they're a good one. There's what else was there? Yeah, it depends on what you're using your toothpaste for as well. So I always kind of prescribe toothpaste depending on what the patient needs from it. So Biomin's a good all-rounder. If you want a whitening toothpaste, there's another option. If you have gum disease, you might go for another one. It's like skincare. So always trying to make sure that you use something that's perfect for your body.
Do whitening toothpaste actually work?
It depends on the ingredients in the whitening toothpaste. So most whitening toothpastes are they are very abrasive. So they usually have like charcoal or salty stuff in there. And what they're doing is basically exfoliating your teeth to remove those stain particles from the outer layer of the tooth, which is really bad. Because, as I said earlier, your teeth are the only non-shedding surfaces of the body. So you only have one set of teeth, you only have one set of enamel. And so if you're grinding away that enamel every time you're brushing, then slowly over years, you will actually remove all of your enamel and you can't grow it back again. So I'm very against those types of toothpastes. There is a few which have just come on the market. So one by Colgate, which is it's called Max White Ultimate, and they use a different ingredient which basically oxidizes the stained particles. So there's nothing abrasive about it. It's safe for your enamel, but it basically releases lots of oxygen particles, which then burst the stain particles, and it does actually whiten the teeth. Like, it actually does work, in my opinion, and it's not dangerous.
Sounds like something I use in my washing machine. Is that good for your microbiome as well?
So it's not bad for it. It's not going to be adding any crazy benefits. It doesn't have probiotics or anything like that, but it's not bad for it either.
And what about teeth whitening, like bleaching?
It's fine. It depends on what ingredients you're using and the percentage. So most whitening uses hydrogen peroxide or carbamide peroxide, which is kind of like bleach, but a much lower concentration. And that's why it's so important that you do get it done professionally with a dentist who knows what they're doing and what percentage they're using on you. In terms of if it's harmful, it's the equivalent of having a Coca-Cola. So every day that you whiten is the same as you drinking a Coca-Cola. That's how damaging it is. So kind of, no, it's fine. In terms of your microbiome, weirdly, hydrogen peroxide is a very effective antimicrobial. So it's actually very good for killing bacteria. And there have been times where I have patients who have really high levels of bad bacteria, and I've actually recommended that they whiten their teeth because it kills the bad bacteria that needs to be killed. So it's very good for that. And then a top tip that I would recommend is making sure that you take some probiotics and prebiotics afterwards, just to basically re-nourish that microbiome and make sure that you haven't lost your good bacteria too.
When you say take it, you take or a probiotic mouthwashes, as opposed to swallowing the pills, or would you chew a capsule? Or
I prefer mouthwashes because there's more of a direct kind of contact and supply. So I use one from Invivo, and it's called Biomi Oral. And in my experience, it's the best one at the moment on the market, which actually does deliver the probiotics into the mouth. And then you actually swallow it. So you can swallow it, and then it has like a double whammy effect, and it can help your gut too. So I use that. And then there's a few toothpastes which have some probiotics in them too. And then prebiotic wise, it's mainly food recommendations that I give.
What probiotic toothpaste would you recommend?
So there's one called Zendium, which is pretty good. So it's got some probiotics in it, and it's also it's very good for people who have sensitive mouths. And that could be because you're going through maybe a lot of treatment. So if you're going through like chemotherapy, or let's say if you're pregnant and your gums are just so sore and everything hurts you, then Zendium is a really nice option, and it's quite soothing for the gums and calms them down.
Well, I've used Designs for Health before. I think they're fluoride free, but they also have a silver toothpaste with probiotics. Have you heard of that one? What do you think of?
Yeah, so I like that for gum disease patients. So the silver is very good it's very antimicrobial. And the Designs for Health one, it's got grapefruit seed extract, which is antifungal. It's got a couple of things in it, which is really good. I usually put patients who have active gum disease on that toothpaste. And then even though it's fluoride free, we can afford to maybe step down on the fluoride whilst we're working really hard on the gums. Then once everything's stabilized, we put them on like an all-rounder toothpaste, which has a bit of fluoride in it.
Mm-hmm. Or maybe could you perhaps alternate? So if you're brushing your teeth sort of every other time with one of them or whatever you...
Yeah, I do that at home. So I use Biomin in the morning. No, I use Biomin at nighttime. So because it's very remineralizing and great for the enamel. And then in the morning, I use the whitening toothpaste I was telling you about, the Colgate Max White Ultimate, just to give me a little bit of a boost during the day.
So interesting. And so should you brush twice a day?
Yes. Twice a day, first thing you do in the morning and the last thing you do before you go to bed.
Before breakfast?
That's dependent on what you're eating for breakfast. So I brush first thing because it's just easier for me, and I don't eat breakfast. So like I fast in the mornings. So, but if you're having, a fruit salad for breakfast with lots of citrus and an orange juice, then you don't want to go and brush your teeth straight away afterwards, because you're basically brushing all that acid into the teeth. If you're having a porridge and something very neutral, then you go ahead, you can brush your teeth afterwards. So it's very dependent. If you're unsure and you're worried, then I would just brush before. You can't go wrong with that.
Okay, because I do actually tell my children to brush before breakfast, but they often have some sort of berries or maybe like some apple or something like that. But is that kind of okay-ish? Because it's not a citrus, or?
Yeah, it's more about the citrus and citrus and sugar, which is your problem.
Okay, so they could brush before or after, it doesn't really matter. Okay, that's really interesting.
Yeah.
And what about mouthwash? I know obviously you mentioned the one from Inviva, which is really good, and one that I use, but the commercial ones.
So I generally don't recommend people to go to the shop and buy some mouthwash, because if you don't know why you're using it, then often you can actually disturb the microbiome and imbalance it unknowingly. So if you have no problems, then don't go and use a mouthwash. You don't need it. You should just be fine with brushing your teeth twice a day, using the right toothpaste, and having the right diet. That's all you need. If you have gum disease, then you should be going to your dentist, who should recommend a specific mouthwash for you. If you have bad breath and you just want something to, pick you up once in a while, then you can just use, like I use like a hydrogen peroxide mouthwash, so like Peroxyl, for example, and that just kind of like kills the bacteria which release sulfur in your mouth. So again, it's very dependent on why you're using the mouthwash, but it's not recommended that people use mouthwash every day unless they need it. And if you're dying to use a mouthwash every day and you really want something, then the probiotic mouthwash by Biome Oral is a good option for just kind of good maintenance. But what I think people need to be aware of, because I see it a lot, is people who, they know they have a problem like gum disease, and then they're like, great, I'm going to go in there, buy some mouthwash, and I'm going to use it every day, and that will sort out my problems. And they use it, and it probably does mask some of the problems, but you need to be seeing a dentist for that. So it should be used in conjunction with dental treatment.
Okay, interesting. Should we use an electric or manual toothbrush?
Generally electric. So it's been shown that using electric toothbrush improves your brushing and your efficiency significantly. So yeah, I would use that. And then for kids, I generally like them using a manual toothbrush first until they're kind of early teens or like 10-ish. Reason being is I think everyone should know how to brush using a manual toothbrush. That there'll be one day where you're at a hotel and you forgot your electric toothbrush charger and you need to know how to use it. And I think every kid should learn how to use it properly. But once they've learned, then they can kind of upgrade to an electric toothbrush, and they will have much better results.
How often should you change your toothbrush or toothbrush head?
Every 3 months.
What about, so flossing, we haven't mentioned flossing, but I know this is really important as well, and that's to clean in between. And, what about those water flossers that are really popular on sort of, I don't know, online? They seem to pop up on my feed all the time anyway. I don't know whether I'm targeted.
So
like high pressure washer for your teeth.
Yeah, basically it is. Flossing is really, really important, like normal flossing. Everyone should be doing it. I recommend it to do it twice a day. So every time you brush, you should floss, because I know that if I tell people to do it twice a day, they most likely will do it once a day. So the reason being is that 30% of the bacteria is actually found in between your teeth. So when you're brushing, you're not actually removing that bacteria in between the teeth. Flossing is the only way of doing that. So you do need to do that. In terms of a water pick or a water flosser, it's kind of like a level up. It's not necessary. Again, if you just have good basic hygiene and you're brushing well and using floss and the right toothpaste, then you don't need to be using a water flosser. But some people like to use it just because it makes them feel good, or it freshens things up. But again, I don't want people to think that that is a replacement for having a hygiene, for example. I see a lot of people like, oh, but I water floss every day. And I'm like, it's not the same thing. There's a reason people have gone through, 7 years of training to become a dentist. And that's because there are places and areas that you cannot get to with a water flosser. And I think that's the danger of the water flosser, is that people think it's like, oh, it's a replacement. That's fine. I don't need to see the hygienist anymore. So
yeah. Can it cause damage though? Because I imagine that it can sort of dislodge. Could it dislodge your gums potentially, or?
Yeah. So if you use it incorrectly or at the wrong frequency, so there's some dodgy ones out there, like a random unknown brand with a very high frequency, and they can damage the enamel, or they can dislodge the gums and hurt the gums, or fillings, or veneers, or crowns. So that's why I don't really recommend it unless someone really just wants something kind of like an extra level of hygiene and they're okay with that risk. And if you do want to get a water flosser, please make sure it is a normal known brand, nothing which is a high frequency or says that it's going to remove everything. Like, you don't want that. It's too damaging.
Okay. What about Invisalign? Or those type of, so they're kind of little shields that you sort of wear day to day. Are they fine? Are they okay?
Yeah, so a lot of patients of ours do Invisalign, and so you're right. So Invisalign is it's an orthodontic treatment to align the teeth, and it uses like clear aligners which you pop in, and you wear those for 22 hours a day, and week by week you change those aligners, and your teeth will move into the correct position every week. They're fine as long as, again, you're doing it with a dentist or an orthodontist who knows what they're doing. I don't recommend going to any of those kind of direct-to-consumer aligner companies. So I will not mention any, but there are some where basically they try and cut out the dentist or the orthodontist, and so you become your own dentist. And the problem with that, it's not that I'm salty or jealous and I want everyone to come to me, but the problem is that if you don't have someone monitoring your orthodontic treatment and your teeth moving, then you can get a lot of problems with your gums, with even with the teeth. I've seen people whose teeth have fallen out, all of this because they haven't had the right support and monitoring from a dentist. So please make sure if you're doing it, do it properly.
Okay, yeah. What about those kind of gum shields that you get if you're tooth grinding? I actually was prescribed one of those, and I worry that it's made from plastic and I'm going to sort of swallow loads of plastic as I'm grinding it in the night.
Yeah, it's a difficult. I mean, if you can try and make sure that your night guard is BPA free, so then that's the best way. Also, some people who are very, very scared of having plastic in their mouths at nighttime, I recommend actually Botox in their muscles here, and that just stops them from grinding completely and clenching as well. So if you don't want anything in your mouth, that's a nice alternative. But yeah, the night guard, that's unfortunately there's nothing on the market so far which is not made out of plastic. So as long as it's BPA free, it fits you properly, and you're getting it replaced every kind of relatively regularly. So I'd say every few years. Not, sometimes I get these night guards that have been like chewed like a dog for 20 years, and you're like, ooh, don't let that happen. Because the more you grind into it, the more things can be released from it.
Lastly, which is probably not going to be a quick question, but should you remove your mercury fillings?
So removing the mercury fillings, again, this is a bit of a controversial topic, and it depends on who you speak to. Me personally, I recommend that if a mercury filling is broken, or it looks like it's chipping, definitely needs to be replaced, because that can be leaching out mercury, and that's the problem with them. If I have some patients who have 20 amalgam fillings in their mouth, and for them to replace all 20 is a huge deal. It's very expensive. It's a lot of treatment. So what I would recommend in those situations is doing a mercury toxicity test. So just seeing, or heavy metal toxicity test. So just checking if you have high levels of heavy metals, and if you're able to clear those heavy metals from your body. If you have extremely high levels, then I think it is an indication, and I'm happy to do it. But for someone who, I don't think everyone needs to have it done. And the reason being is that actually removing those amalgam fillings releases more mercury than actually keeping them in the mouth sometimes. So I only think it's indicated when the advantage of removing it is more beneficial than keeping it in the mouth and they're completely intact and there's no problems with them. So again, it's really dependent on each person's mouth.
And is it true that you as a dentist can also check if they're releasing anything, or if there's anything leaching from the fillings, apart from the test that you just mentioned, where to see what's actually going on inside the body, but on a surface level?
Yeah, so just clinically you can see that. So if they're starting to they start getting a bit kind of crumbly, a bit chipped or broken, then that's enough for me to want to remove it and replace it. So every person who comes in for a checkup, I do check, and if they have anything like that, it has to be replaced. It's just that, like I said, the problem now is that we have, it's called the heavy metal nation, and it's kind of the 40 to 60-year-olds who have a lot of metal in their mouths. And it's just that, unfortunately, dentistry at that time, there was a lot of amalgam going on. And so the problem with that is that I get a lot of people who come in and they're like, great, I want to change all of my amalgam fillings. And amalgam fillings can be very destructive to the teeth. It might mean that you need, 20, 30 fillings to be replaced. It's a lot of mercury release. There's a lot that people don't see, and they think it's really easy, and it's not. So again, I kind of chip away at it slowly and just remove the ones that are leaching out mercury.
And so if you've got something that needs replaced, or your dentist says, this is disintegrating, or whatever, it's about to fall out, we're going to take it out. How long, at what point do you always have to do that before you get pregnant? Or is there something that can wait? And if you have to do it, how long before then you actually start to try to conceive, should you do it?
So there's no guidelines out on that at the moment. For me personally, I would say it should be like 3 months before you're trying to conceive. You should try and remove them if you know that they need to be removed. If like during pregnancy, absolutely not. Don't try and replace any of your fillings. Not worth it. And then also breastfeeding as well. Don't try and replace those fillings. So either 3 months before you're trying to conceive, or probably a year and a half after birth, can you start thinking about replacing those again.
Mm-hmm. Okay, great. Gosh, this has been so interesting. Thanks so much, Victoria. I've kept you longer than I'd planned already. But if anybody wants to come and see you, how can they find you?
So I have a clinic in Mayfair, so it's called the Health Society. We're just on Lee's Place, so you can just Google us, or you can find me on Instagram at Dr. Victoria Sampson, and then I can direct you there.
Thank you so much.
My pleasure. Thank you so much for having me.
I really enjoyed this chat with Victoria, and I hope you enjoy listening to this episode. Please like, share, and review this podcast as it helps us reach more listeners.